last 2.5 days, we have been learning what to do for various fractures. So sometimes you learn from cases what not to do. So this was maybe my worst encountered case where I learned what not to do, and I think you all should also do that. So this is an 8-year-old male who had a history of fall. This was way back in 2015. So what's the diagnosis from this X-ray? I think it's pretty clear. Monteggia. Yes. So it's very clear. We've been learning how to identify, how not to miss. So there was a clear ulnar fracture with radial head dislocation. So how would you treat this patient? Anyone? So this, yeah. So maybe that doctor who had not attended IFICS, he thought it's just simple ulnar fracture, did not see the radial head dislocation. And since all fractures in children heal very well, he just put it in cast, and at 6 weeks removed the cast, and that was the picture. So now it was very clear, even earlier it was clear, but ulna united and radial head was dislocated. So we've also learned how to manage these fractures in last 2 days. But what the surgeon did is that he identified now that he had missed that Monteggia, and to correct that, a corrective ulnar osteotomy was done. Open reduction of radial head was attempted, and it was fixed with K-wire, and this was the picture. So the X-ray is not very clear, but the radial head was not reduced. There was transcapitular wire which was put, and this got infected, and hence K-wire removal needed to be done after some time. So after that, again, he attempted, said now it is not working, so he said there is chances of infection. So he tried and do, again an osteotomy was revised, and now he tried to put it a Jess fixator after debriding the ulna. Radial head was still dislocated, and you can see that even the Jess fixator was not stable, so he has put an additional slab on that. Obviously, this did not work. Again, a repeat surgery attempt was made, now with a different technique. Maybe took a help of somebody. Now an internal fixation was done after the infection was controlled. Jess fixator was removed. Ulna plating, he used fibula graft and did again an open reduction, tried an open reduction of radial head, and again fixed it with K-wire, but again you can see that the radial head is still not reduced. So none of the principles followed, and then still, taking attempts after attempt to salvage. Finally, this was also the last attempt. Everything, plate tried, nail, Jess fixator, and finally, because of persistent infection, the plate had to be removed, and then he was put in Elizaro, and now this was the picture. After doing the Elizaro, again, everything not restored. Still there was infection, so subsequently even the Elizaro was removed. So 6 years after the primary trauma, which was very, very obvious, could have been salvaged and properly treated at that time, he underwent 4 failed surgeries, and this was the picture with which the patient presented to us. He also came with a CT scan. So this was the clinical picture, where you can see that ulna is totally atrophied, radial head is dislocated, ulna has become almost like a pencil thin, and he has this clinical picture with elbow deformity, fixed flexion deformity of 50 degrees, further flexion up to 100 degrees, pronation, supination restricted, and he has a very bad soft tissue scar. So these are all the challenges now for reconstruction. You have ulna which is totally atrophied, non-union, you have a deformed and dislocated radial head, the soft tissue is totally compromised, the skin is totally adherent to the bone, and he has already undergone multiple surgeries. So Maulin, what will be your option on this now?
Consider single bone forearm.
Yeah. So now this is beyond salvage. You cannot give him all the forearm movements are not possible because ulna is almost not there. So we also decided, as Maulin said, for doing a one bone forearm, which is called an ulnaeus procedure. Dr. Mandar demonstrated yesterday for some other indication. So when we open, you can see, look at the radial head, which was totally damaged, destroyed, and so that was excised. And we did the osteotomy and put the distal radius and united it, put the plate fixation with the proximal ulna. So that was the picture. And this was immediately at 6 weeks follow-up. patient was, the fracture was uniting well. The patient had good range of motion. And this was the clinical picture at 6 weeks. And he has come recently. I don't have the final picture, but everything is doing well. So this was Alnia's procedure is well described. For lack of time, I will not go into the details. So what this case tells us, that if you don't know, obviously the first case, first trauma X-ray was very evident, but otherwise take help, but do the right management at the earliest. Thank you.